Welcome to Boston Children's Answers Parentcast. I'm your host, Jennifer Arnold. As a doctor and a mom, I'm passionate about helping kids stay happy and healthy. So join me as I chat with other Boston children's experts to find answers for you and your family. Hi everyone, and welcome. Today we're talking about how to transition your child from pediatric to adult care. Let's start things off, as we always do, with our parent question.
Hi, this is Taylor. My son has a chronic condition. He's getting a bit older now, and people are starting to tell me we need to look into adult doctors for him. This is stressing me out just a bit. I'm really wondering where I should start with this process.
Every kid needs to graduate at some point from pediatric to adult care. And children with special health care needs are living longer and requiring specialized care well into adulthood. And for this population, it's more complicated than just switching from a pediatrician to a primary care provider that treats adults. Here to offer some insight on managing those transitions is Dr. Ahmet Uluer, director of both the Boston Children's Bridges Adult Transition Program and the Adult Cystic Fibrosis Program, which is a joint program with Brigham and Women's Hospital. Welcome, Dr. Uluer.
Thank you so much. First of all, it's such an honor to be here, to be on your podcast.
Thank you.
I'm so thrilled to be able to do this, and thanks for the invitation.
Well, I feel equally as honored, especially since we go back as friends, colleagues, and
That's
just
right.
you've helped me in my transition here. So even though I'm an adult, so thank you for being a good friend to me. One of the first things I'd love to know and ask is, how did you get into this field?
I'm a medicine pediatric trained pulmonologist. I was drawn to adult medicine, but I have a very pediatric sort of, way of practicing, I guess. And during my residency, I met a lot of people who were survivors of, pediatric illness, either congenital or acquired. And, I really enjoyed working with that population. And eventually, met people with cystic fibrosis, and that's why I really went into pulmonary medicine. I also realized early on that, when these folks came from a pediatric, approach to care into an adult one, there was a lot of, sort of bumpy road between that time. And it really occurred to me that, and to a lot of other people who do this work, that, having a good transition process was needed so that, people could be successful adults. And so I thought, let me get into this.
That's incredible. Well, I mean, as a doctor and in this situation, more importantly, a lifelong patient who has chronic conditions, that I completely understand how important that handoff is and that transition. And something that even to this day I struggle with. So I'm curious, why do kids, and particularly the patient populations that you work with, need help with this transition from, pediatric care to adult care?
It's such a good question and complex one. A lot of people need help with transitioning, and I think about my kids and who are young adults, and, they need help with trying to figure out how to use a pharmacy. And if they're, working and they're going to be getting a new insurance plan, how do they know which one to choose? And if someone isn't talking to them about that early on, and, in our house, we definitely did do that since that's part of what I do, they may not be, well prepared for that when the questions come, and maybe we're not there to help them, with that. 15 to 20% of young adults have a chronic illness.
Wow.
And I think the estimate is about 500 to 750,000 kids are graduating into adult care every year.
Wow.
So that's a lot of people. And, many of them have, asthma or diabetes, sort of a single chronic illness. But then so many others have multiple complex things where there's a need for care coordination. A lot of different subspecialists are involved. And, that is a much more daunting challenge for, that young adults and their parents and caregivers, to be facing. So it is really critical for there to be a team, both on the pediatric side and hopefully on the adult side, to provide that guidance.
And I think about, for so many adults, right, we hear how hard it is to navigate the healthcare system, how to coordinate your care if you have multiple medical issues. And I can't even imagine how hard it is. Well, I guess I can actually, for young adults and teenagers. It's hard enough just becoming an adult.
Yeah.
Aside from then having to manage your own healthcare and find new physicians and coordination in your care. That's a lot.
We talked about sort of the other multi-specialty chronic illnesses that are difficult, but then there's also people with neurodevelopmental delay who, are cared for by their parents or other caregivers who often need to go through the legal process to obtain guardianship. And, that process is really, pretty important to get started on way before someone turns 18.
It's a shared effort in all aspects of healthcare to make those transitions as effective as possible. So that's really great.
We talk about co-production of care all the time. And so bringing that to this transition, conversation is really important.
Like I oftentimes think about my own life, right? And I had to transition from pediatrics to adults. It's hard. And I imagine that most families and kids don't really want to leave the care team that they know well. So I'm just curious, why is it important for having a plan and thinking about that transition from pediatric to adult care?
Yeah. I mean, one big one is a sense of hope. We don't expect you to, just be in pediatrics only. You're going to survive, and you're going to be, an adult and who hopefully will continue to improve life expectancy and quality of life. So people with cystic fibrosis, for example, when I first started, the median age of death was in their 20s, and now it's going into the 40s, and the median life expectancy may soon become a normal lifespan. Sickle cell is similar. The median life expectancy is 58, and and now that there's new medications and new gene therapy options, life expectancy is something that will also maybe equal that of the population without sickle cell. Wow. So it is also, providing a sense of, self and empowerment to say that you're going to be, have autonomy over your health care and your life. And, the reason also to do it is that we know that if you don't have that type of preparation, you're going to end up in gaps in care. So we know that in studies, if transition processes are in place, people's health is better, their outcomes are better. In diabetes, in a group that received transition support and in a group that did not, there was a difference in hemoglobin A1C, so control of your blood sugars. And then also in asthma, there was an increase in emergency room utilization, and there was a gap in filling prescriptions and medications. And some of it might be also because there's a lapse in insurance and you have no idea how to get it reinstated, and you need that help.
Yeah, it's from very practical reasons up to just longevity and overall health. Not having that care that you need as a individual with medical complexity, and that can be really, really bad.
Yeah.
Well, so it sounds like transitioning is really important. What are some of those kids that need to be thinking about how to transition from pediatric to adult care?
It's really almost everybody. Pediatric hospitals are, really designed to care for children, and pediatric hospitals are really also, bursting at the seams, taking care of those children, and thus, when we have patients who are achieving adulthood, there are many other adult institutions out there. So it is, a good plan for us to be doing the right thing and having adults in adult medical homes, but also then opening up pediatric institutions for, kids that also, need beds and, be able to have access to that type of pediatric care. I think that's an important message. Pediatricians don't know about managing hypertension or, colorectal cancer screening or getting your mammography. So no matter what you have, if you're surviving into adulthood, there's some of these complications that happen just with aging.
Yeah.
And so, that's really important. But there are also, medical, chronic diseases that right now, because it is a new thing that people are surviving into adulthood, especially metabolic diseases, which are really complicated, require certain types of nutrition that maybe they don't have in stock. There are also people, who may require pediatric-sized devices and pediatric-sized. Right?
I'm one of them.
And so, it is important for people to have that access. And so we talk about hybrid care, that, maybe there are certain things that need to continue to happen at a pediatric institution. If that's really the only place that care can be provided, that type of hybrid care is happening now. And, we're making sure, though, that we're trying to train that next generation of adult doctors. But in the meantime, that some of the care may need to stay here.
Well, it's interesting that you say that hybrid care piece. I think that's so important and powerful for so many populations. And I mean, we're lucky, right, that here we have adult hospital that we can partner to provide the adult pieces. And then for those things that maybe can't completely transition to adults because there's not enough knowledge or experience in the adult population, that you can still get the pediatric care pieces that you need, because you don't want to miss one for the other as you become an adult, which makes it again more complicated and challenging. I think about my cancer journey, right? When I had cancer, I had an adult cancer that nobody in the pediatrics cares for regularly, so I needed an adult GYN oncologist. But then I had so many considerations related to my chronic illness and my genetics condition that I needed pediatric sized equipment and supplies. And I was essentially cared for in my children's hospital, but co-managed by an adult and a pediatric oncologist. And that ended up being the best of both worlds. Yeah.
It is important for the two groups to share their knowledge, because their outcomes may really depend on that collaboration.
Yeah, well, and we're lucky here, right, that we have you with all this expertise, and then the Bridges program. So can you tell us a little bit about how the Bridges program works?
The Bridges Adult Transition Program, or we like to call it Bridges, is a program that is composed of a multidisciplinary group of people. It is social workers, nurses, nurse practitioners, and key to a successful transition program is a transition coordinator. In this case, we have a nurse transition coordinator. And in studies that they've shown, programs that have a transition coordinator are the most successful. And so that is really a critical part of what we do. And thanks to the pandemic, telemedicine has become such a big part of our lives, which works great for patients and families, especially if they have a chronic condition which makes travel back and forth to the hospital so difficult. To be able to have that conversation, especially about transition, which is not a conversation they want to have, in the comfort of their home, to be able to be open about challenges, that are there with
and their
transition.
Questions.
Yeah.
Yeah.
And one thing I'll just add is that we didn't talk about sort of the definition of transition and transfer. Transfer is that handoff, but it's sort of like a moment in time, or in a 3-month period.
Yeah, beginning and an end. Yeah.
But the transition is really, starts, either at the time of diagnosis, really emphasized around age 12 with a lot of different, guidelines on how to prepare for adult care. And then there's that hopefully warm, empathic handoff. And then the transition process, continues.
Yeah.
So it's really important to know our community. And for any transition program across this country, each community is going to be different. So where do parents go? Where should they find that, that guidance? Hopefully their community institutions, have a program just like ours, helping, with this exact question.
What I'm hearing is start early, have that conversation with your care team.
Yeah.
And then start identifying how to make that sort of transition plan in a very empathic way. Yeah. And you kept saying empathic, so I was wanting to learn a little bit more about why that's so important, to have not only have the medical sort of transition piece, right, but also the empathy piece.
Yeah. I think that empathy, partnering, trust, these are terms that we use because they're essential to being able to practice medicine. Because if you don't have that someone isn't going to maybe take the medicines that they're supposed to take or come for that follow-up. So I think having that really will help somebody not fall through the cracks and into those gaps of care that we talked about. And transition, we feel, is really individualized. And that is part of our mission, because not everyone's the same and not every disease is the same. Also, we have to take the consideration of that family and where they live. So we really try to work with families and making sure that that handoff is to somebody that they can trust and that they can work with. We do a lot of expectation setting, and that's really actually critical because, pediatric care.
Adult and pediatrics are very different experiences.
They're very different experiences. And it's not that, the experiences are bad, but it's that it's not. It's just that there's a patients and family-centered approach in pediatrics, and that's multidisciplinary. So
it's just
that's
scary
how it is.
for the patients, right?
Yeah.
It's scary for the families, and there's a lot of differences in terms of, like you said, the experience of care in pediatrics versus adult. But it needs to happen. It's a good thing that it happens, but it's still scary. So we got to handle it carefully. So all of this transitioning that has to happen is obviously very individualized for the patient and their family. But what are some of the common, conditions that pediatricians and patients and families that we might want to think about needing a transition plan?
Some of the transition still is needed for those with less complex illness, but the complex illnesses are the ones we focus on the most because they need the most care. And we think about things like cystic fibrosis, sickle cell. Spina bifida is a really big one because that really is a multidisciplinary approach, and there's a lot of things there that we don't touch on as as pediatricians, including sexual health and fertility, and then those with neurodevelopmental delay, those with just complex illnesses and rare diseases that are genetically inherited that we're learning more and more about, that really touch all the different subspecialties.
Yeah, no, it makes sense that there's so many different types of, situations where there's medical complexities, a lot of medications needed, maybe interventions. You have all of the things that relate to the individual's medical condition, but then you also have to think about all of those things that are needed for adult care, right? So when is the best timing to think about or to transition care?
It is really individualized, and some people may be more, ready to transition earlier. So maybe 18 works for some. For others, 21 is a common age. If you're going to college, that's about when you're, deciding where you're going to live, where you're going to take that first job, if you're coming back home or not. So that's a time where maybe you do that full transition, that handoff, because you don't want to do it multiple times necessarily in that young age group. But then really, it could be 24, 25, 26. And, the Affordable Care Act did allow people with chronic illness to stay on their parents' insurance until age 26.
For many populations, sounds like there needs to be that shared hybrid model. And then making that transition time really depends a lot on the individual, the family, the situation, what's going on in their lives, college and insurance and all of those other things. So a lot of things to think about. I'm curious, is there like a particular deadline that you would consider? I'm thinking I'm 50. Do I have to transition? Just kidding.
You can work here.
Okay, good.
Yeah, that's good.
That's how I keep my pediatric care going on. I would just work in the place.
So I think eventually everyone needs to transfer, and we're hoping that because medicine is getting to where it is now, that you're adult, there's going to be new specialties. There's going to be new specialties for, the young adults or adult with these rare conditions.
I am so waiting for there to be adult, PCP type, internal medicine generalists that specialize in adults with medical complexity, because we have that in the pediatric side, right? So, my kids go to, typically a complex care doctor in addition to their subspecialists. And I don't know if that exists on the adult side, but I think we need that one.
Yeah. What's interesting is that in adult medicine, a lot of the complex sort of subspecialty needs actually are cared for by the PCP. Oh. So they are trained as complex. Care physicians, and often they will manage diabetes. They will manage high blood pressure. They will manage, simple GI, issues like reflux or irritable bowel syndrome. And so, I mean, to your point, PCPs in the internal medicine world are really geared to be complex care physicians as well.
I guess you're right, because you think about the adult population in general compared to the pediatric population. Many of them have multiple medical conditions, so that maybe they're trained for that. Well, as we're thinking about transitioning, are there any traits that we should be looking at related to an adolescent or young adult that signals they're ready to transition?
Yeah, we do have readiness tools, and that helps us with that guidance sometimes. Sometimes you just know it when you see it. And, other times that someone is going to need a lot more hand-holding. I don't really have like one, sort of key, driver for me that says this person is ready. But we as a team will know when someone is ready.
Okay, that's really helpful. And there are some tools, it sounds like, and it sounds like it's a lot of conversations. That's what we're working with. That your team and the Bridges team, like, they can sort of figure out, okay, this child's ready now, or, young adults. I think about, like, I don't know, my son's 14. He's only 2 years technically away from being able to drive, and I feel like he is way not far ready.
Right.
Maybe he will be in 2 years, but ooh. So there's all these things you have to think about. Any tips for a parent who's thinking, is my child ready to start, managing their own care, that they can be asking themselves?
Yeah. I mean, if your child is able to, set up an account for Instagram or order a pizza, they can call a pharmacy and order their prescriptions.
That's a good point.
So looking at those sort of correlations can really be helpful. And one other thing I will just say is, and our social worker uses this example, is that when you graduate from high school, you go to college, you can't tell that English teacher in college, I prefer my high school English teacher. I'm going to go back.
That's true.
You are now in college, and no one thinks that they have that option. And so it's similar, there's that new person with that new knowledge and a new experience, and it's important to, hear their perspective as well.
Yeah, and you'll continue to learn and hopefully, get the right care that you need.
Right.
Okay, now say you've decided, let's transition.
Yeah.
What does that process really look like for families and for patients?
So first we have a first meeting, and we just sort of say hi and introduce ourselves, and then make sure that they know that this isn't happening now. This is happening a year from now, 2 years from now, maybe in 6 months. It just depends on, the person and what they, the individualized need. And at first also with trying to figure out where that subspecialty care is going to take place, because that helps us determine where that primary care doctor should be. So finding the PCP is where that starts, and then we sort of fit in where that subspecialist is.
The other pieces kind of fall into place.
And we also create a medical summary with the family. Like, we work together on it, because it's important that they also include, the things that they think are important, including social history and all of that other complexity that might be going on in their lives.
So important. And that would be so helpful. I mean, I think about how many times I've had to share my story, and I'm like going back to 2 years of age. Okay, yes, this and this and this and this. If I just had it in a nicely written, organized handout, that would be incredible.
That's what the the transition coordinator does, is makes that easier. And as she does it, they're more and more really specific to what that person needs.
And I can imagine too that a lot of, even if a family is trying to transition to adult care, as they move on to those adult care team members, I can imagine that things get lost in the shuffle if it's all reliant on your memory. The details, which could be important, could get lost. And so having that sort of, I don't know, holy grail of information is probably really key. And,
you remember maybe in your practice, the parent who comes in with a stack of, files.
Yes, that too. Yes.
And then there's those parents who have like 2-3 pages of all the most important things you need. And you're like, thank you.
Yes. I can this. Process this.
Yes. And so it has to be digestible for sure.
Yeah. So we talked a lot about transitioning and how important it is for the individual patient and family. Tell me, like, from your perspective, why is it so important, just on a more global perspective, for healthcare in general?
There's a lot more adults medical beds than there are pediatric ones. And so we are stressed. The system is stressed for taking care of, children, newborns, adolescents. And so it is also important as a national healthcare initiative to make sure that people are in the place they need to be for that care. Other countries, the cutoff is 18 and that's it. I think that a lot of adolescents who are not ready, have difficulty with that. So I think it's still okay to have a more relaxed, age of when transition and the eventual transfer occurs. But we also need to make sure that people are in the right place and, making sure that we have the capacity to care for children in the place they need to be cared for. It is really the pediatric institution where their care is most, most valuable. And so we need to make sure that those beds are available, and not because we want to, kick people out, because these adult survivors, we care about them. We got them here.
Yeah.
We want them to succeed, but that we know that their success happens in a place where the adult system is ready to care for those adult issues.
Well, and also if you're an adult in a pediatric institution and you have an adult emergency or an adult problem, you may not have, again, the best experts to care for you in that situation. Yeah. It's not that strokes don't happen in kids, but they certainly don't happen the same way or the same frequency as they might in an adult. So it's all about the right care at the right time,
exactly,
at the right place.
So I'm so glad you brought that up.
Yeah, so I guess you've heard that phrase, kids are not little adults and adults are not big kids.
Yeah.
They have different healthcare needs
Yeah.
and complexities related to just, being an adult versus a pediatric patient. But at the same time, the populations that we're talking about are those with medical complexity also need that knowledge and expertise. So again, it goes back to this, making that bridge so that you can get the right care. And so I just think it's so great that we have the Bridges program here. Do other places have similar programs?
We have a lot of colleagues around the country. It's something that's not just nationally, it's worldwide. The pediatric institutions in other countries are so stressed. Imagine just how difficult that is. We're blessed that we at least have the capacity to take care of children into young adulthood.
Yeah.
Our mission, along with all the other colleagues that we have across the country, are to make sure that we're providing a comprehensive approach that is individualized and makes sure that the transition from pediatric to adult care is seamless. And so we need to make sure that that adult institution is prepared and ready.
So what do patients and families do if there aren't any adult primary care providers that have any expertise in their conditions?
There is a lot of like a hands-on approach to this. And I think that
a lot of communication, and there is really, I can't think of another way to do it that isn't individualized, because otherwise, they'll go to one visit, it doesn't work out on both sides, and that person will then, be out there on their own. I think about the fact that not that it's all about me, but I think about I have a 1 in 100,000 live births, condition, right? It's very rare. Yeah. I can't expect that I'm going to find a PCP as an adult that's familiar with my condition. Yeah. But I also didn't have that either when I was born. So I think it's like what you said earlier. It's remembering that we had a hard transition just at the time of diagnosis or the time of, realization when you have a rare or complex medical issue. But you built that team over time. And so we just have to sort of rebuild that again. Yeah. It also goes back to the fact that the patients and the families, they're oftentimes the experts on their health.
And that is such a critical part. I mean, when I teach medical students and fellows and residents, it is all about listening to that story, to that patient, because the technology will only get you so far, but you'll get so much more if you're listening.
Listening, exactly. Yeah. And empowering the patients and families to be their advocates for their health too. It's partnership.
But giving them some patients don't know to flex that.
That's right.
That part of they will think that their role is to listen to what the doctor says. Yeah. It is really making sure that they know they're part of it.
Yeah. It's information gathering, and it helps you to create the best plan.
Absolutely.
Yeah. Oh my goodness, Dr. Uluer, it's been a fun conversation. I've learned so much. Is there anything that we haven't shared yet with patients and families that they need to know?
Yeah. First, there are, a lot of opportunities out there for education on this subject. There are in our organization social workers who also have taken on this, this challenge. We work together with them. The Bridges program and the social work transition committee work together to provide caregiver training, often in multiple languages, and invite caregivers to meet us. So education is a big part.
Searching on the web,
Yeah.
like you can find,
Yeah.
like we know, like these are things here, but for
Right.
anyone, like just search in your local area, maybe at your medical institutions, maybe they're doing similar things.
Yeah. There's programs everywhere, all parts of the country and the world where people are working on this. So locally, look on the web. If your Googling isn't working, you can go to that website called gottransition.org and look for resources there. And, there are societies for different diseases. Those societies have connections and links to people who may know about the transition needs and work that's being done.
And helping you find those
Yeah.
experts. There's great resources out there, and they, every patient and family deserves this, type of help in transitioning. It's great.
And, one thing I'll just offer that we didn't really talk about is those barriers to transition, because they can be both on the provider side and the patient side. And on the provider side, sometimes we're the barriers. We sell ourselves to our patients to make sure that they trust us and understand our incredible capability, but we may be, preventing that nice transition from happening just from the, how we present ourselves.
And them to try somebody else if they already know they've got the expert.
Yeah.
Why would I, take the risk?
And interestingly, research after research shows that parents and providers together think the transition process is going to be a horrible process. And the adolescent young adult doesn't have that perception.
Interesting.
They think that they're going to be okay. And so maybe listening to them and making sure that, preparing them, and when they do go, that they're going to even be more ready than they thought.
Yeah.
But they're less concerned than we are.
Well, and like you said, starting early in this conversation, you can ensure that by if the patient themselves, if the adolescent feels like they're the ones that can handle it better than anyone else,
Yeah.
and if we've given them the preparation to be successful, then it's a win-win.
They're ready. They're so smart.
Yeah. Now on to doctor's orders. This is the part of the show where we prescribe an action that you can take today to help raise healthy kids.
Understand that transition is just part of life, and you need to embrace it, and you need to empower your young adults to make sure they know that they can do this, and to not be fearing it, but to embrace it.
That's such good advice. This is a good thing. And, you're reminding me a little bit of something my mom I was watching a video of her recently when I brought home my two kids who were adopted internationally. And she was sharing and tearing up, of course, as all moms do, about how she couldn't believe that I had already exceeded her expectations of what would be possible for me as I became an adult with as a person with so much, kind of going against me. And she's like, I just wanted her to grow up and to be happy and to, have a fulfilling, job and be independent. And now she's not only has a wonderful career, but is married and happy and has two beautiful kids. She's like, I just never even, knew if this would be possible for her. So she's exceeded, and I'm just so happy. So that's what every parent wants for their kids, right?
Yeah. And, look how proud your mom is.
Very lucky. I have a great mom.
Yeah.
So, and I expect the same for my kids too.
And we're expecting that for those other parents out there to be proud of their kids.
That's right. That's what it's all about.
That's right.
Thank you for joining us today. And a big thank you to our guest parent, Taylor, and our guest expert, Dr. Ahmet Uluer. Subscribe to our show to stay up to date on the latest episodes. And for more information, please check us out at bostonchildrens.org. See you soon.